Hi everyone, my name is Malaya, and today I'm connecting current public issues to what we've been learning in class this past semester. The topic I chose is the recent increase in the West Nile virus activity in the United States. The article I'm using is from the CDC and it was published within the last 90 days. The CDC article explains what the West Nile virus is, how it spreads, and why it continues to be a growing public health concern. The West Nile virus is mainly transmitted through the bite of an infected mosquito. The mosquitoes get this virus by feeding on birds that are already infected, which creates a natural cycle between the birds and the mosquitoes. Humans, like animals and horses, can also get infected, but we're considered dead in hosts because we don't spread the virus back to the mosquitoes. The article also highlights that most people who do get infected usually don't show symptoms, but those that do develop fevers, chills, headaches, joint pain, or a rash. In more severe cases, the virus can affect older people and can cause life-threatening effects, especially those who, like I said, are older or who have weakened immune systems or are immune compromised. The CDC emphasizes that there are no current vaccines for humans, so prevention comes down to reducing mosquito exposure and in controlling the mosquito population. This includes things like wearing insect repellent, removing standing or still water, and using window screens. This topic connects to several ideas we've covered throughout the course of this class. My favorite one, and the first one, is communicable diseases. And communicable diseases are caused by pathogenic biological agents that can be transmitted from an infected individual to a susceptible one. The study of communicable diseases focuses on understanding that the agents are cause of the infection, which would be the infected birds, the hosts that carry or contract the disease, which would be the mosquitoes, the environmental conditions that support transmission, which would be heat, heavy rainfall, or standing water, and the modes of transmission, how the disease spreads. The disease spreads through the bite of an infected mosquito. Another topic that we've covered is environmental health. West Nile virus is directly influenced by environmental factors. Mosquitoes breeding increases with warm temperatures, heavy rainfall, and standing water. This is a reminder that public health isn't just about hospitals or medicine, it's about neighborhoods, climate, and local ecosystems. Another topic is disease surveillance. The CDC article talks about how cases are tracked in both humans and animals. Surveillance helps public health officials identify breakouts early and warn communities. This ties into epidemiology and how data is used to prevent the spread of diseases. So all of this contains into like one big giant ball. Another topic is prevention and promotion. Since there's no vaccine, prevention focuses on behavior changes, like using repellent and avoiding outdoor activities at peak mosquito hours. This fits into public health approach of reducing risk before illness can happen. Another topic is policy and community interventions. Cities often respond by spraying insecticides, running mosquito control programs, and educating the public. All of this shows how government and public agencies work together to protect communities. So it all goes hand in hand. It all basically falls into a stack or like a stair. My first reaction is honestly how easy it is to forget that mosquito-borne illnesses are still such a big problem within the U.S. Sometimes we think breakouts only happen in other countries, but the West Nile virus is found in almost every state in the United States. It's found in 50 states within the United States. It also makes me think to how climate change affects public health. Warmer summers and more flooding can mean more mosquitoes, which means a higher risk. It's kind of wild that something so small such as like a puddle or a little creek or a stream can turn into like a huge public health hazard. Overall, this article helped me see how everyday environment shapes community health. It also reminds me why education and prevention are such a big part of public health. Simple habits can prevent serious illness. I think it's important that we all work together to prevent and warn others about occurrences that are going on in our community. I didn't even know this was an issue until I found it on Google. I didn't know that mosquito-borne illnesses were such a big thing. I didn't even know about the Nile crocodile, the West Nile. I even know about the West Nile virus. I think That's a huge deal, and it really affects so many people across the U.S. in neighborhoods and communities and children and people who are sick and people who are old. And I feel like we need to take more precaution and take proactive approaches when it comes to dealing with illnesses and public health.